on a house. These are political things that you are saying that it looks good only on the books, not on the outside. In India, we have a system called the National AIDS Control Program. Everyone is aware of that. हमारे पास इतना अच्छा सिस्टम है, इतना फ्लो के साथ वो काम कर रहा है अपना, जिसने एड्स की जो कंडीशन है वो 75.9% को रिड्यूस किया है इन इट्स प्लेस, इट इज करंट इन इट्स प्लेस 5. आप इस सिस्टम को क्यों हटा के एक ऐसा सिस्टम लाना चाहते हैं जिसका आउटकम आपको पता ही नहीं है कुछ? You are dismantling it, it is working smoothly, gloriously, it is doing its job. तो फिर इसको डिसमेंटल करने की जरूरत ही क्या है? And most importantly, these systems that are currently working, that is HIV specialized centers are present here, that are doing their job in a very good manner, in a very flow. But if we dismantle this system, we are bringing the vulnerable side of the disease to the people. Because we will lack expertise, we will lack dedicated care, and we will lack a system that has taken so many times, decades to be built like this. Another thing is, you talk about transformation, we have to go for innovations and digital health. In a country like India, where basic amenities are a luxury, transformation is an expensive luxury we can't afford in a climate of funding reductions and global disruptions. We can go for sustained care that has been doing wonders in its field, जो अच्छा प्रोवाइड कर रहा है. हम क्यों अपनी इकोनॉमी को शिफ्ट करेंगे उस जगह पे जहाँ पे अभी हमें इतनी नीड नहीं है? हमारी लिटरेसी रेट को देख लीजिए, हम अनपढ़ को क्या बोलेंगे जिन्होंने पढ़ा नहीं? आप एसएमएस चेक कीजिए अपना, आप एसएमएस चेक कीजिए, आपने दवाई ली. जहाँ पे हमारी प्रॉब्लम अभी पॉवर्टी है, अनएम्प्लॉयमेंट, सैनिटेशन है, हमारे जो पढ़े लिखे लोग हैं वो क्या कर रहे हैं? उनके पास एम्प्लॉयमेंट नहीं है, पीएचडी करके घर पे बैठे उनको आप बोलेंगे एचआईवी का एसएमएस देखिए, वो सुसाइडल है. यहाँ पे करंटली हमारी सैनिटेशन सिस्टम, इतना पोल्यूशन है, इतनी पॉवर्टी है, जहाँ 2 वक्त की रोटी लोगों को नसीब है, उनको कैंटीन से क्या बोलेंगे? How will you tackle that? How are you asking for redirecting our sources for what? Nothing. There is nothing about it कि हम अभी इनोवेशन पे जाए. हमारी कंट्री अभी उतनी डेवलप नहीं है कि हम इस पे इन्वेस्ट करें. रादर देन हमें बेसिक एफिनिटीज पे अभी ज्यादा फोकस करना चाहिए.
Well, I respectfully disagree. The opposition claims that transformation costs us the loss of our specialized care. But हमने loss की बात तो की ही नहीं. That is not the case. Transformation expands care beyond centralized institutions and main healthcare systems. इसका मतलब ये नहीं है कि एक का काम छीन के दूसरे को दिया जाए, बल्कि उनके साथ-साथ उन systems को भी इंटीग्रेट किया जाए जो कि हमारी funding reductions. Exactly. That is why it's not just about hospitals or clinics. Transformation also includes community involvement and global solidarity. We know that HIV, it is a global problem, a global challenge. और कोई एक country अकेले इसे कभी manage नहीं कर सकती. That is why it is important that we share the cost, we share responsibilities, because shared responsibilities ensure that the people who are in great need, they get their treatments. And also, transformation, it places community at the center of the response. Community-led services improve access. हम ज़्यादा लोगों तक पहुँच पाते हैं, and it builds trust within the healthcare system. क्योंकि लोग अपनी community पे किसी भी आए गए official की बातों, उसकी स्पीच पे या कहीं दूर दराज कोई हॉस्पिटल है जहाँ HIV का ट्रीटमेंट होता है, इससे ज़्यादा वो अपनी कम्युनिटी की बातों पे भरोसा करते हैं. So using community, we can reduce the stigma and we can build trust in them and encourage them to go for the treatment. For example, in Rwanda, East Africa, 70% of their HIV programs are locally funded, while also using international aid, which means they are sustained and independent at the same time. So, it proves that community involvement and shared responsibilities help transformation in a positive way.
I am very amazed how this lady is so brave. She is dropping one bomb after another. Firstly, you talked about dismantling existing systems. After that, you asked to reconnect our sources from our basic affinities to this punch. Another one, now are you asking shared responsibilities? Look, the effort when you realize relies on global solidarity and shared responsibilities. This is a diplomatic term for shifting the financial burden away from wealthy nations. Have you compared the Indian economy and the economy of USA? Indian economy, our economy is 4.3 trillion. How much? 4.3. And that of USA is 30.6 trillion. That is approximately 10 times more. Are you asking India to pay the same as USA? This is shared responsibilities. This will take away so much from. This will burden the developing countries. We are in the third world countries. This will burden us, not USA, UK, or the developed countries. Another thing, you are asking about the community-led model. When the affirmative highlights community involvement, relying too heavily on community services can compromise the quality and the standardization of the care. ये बोल रही है कि हम बच्चे के हाथ में बंदूक दे देते हैं, वो क्या करेगा? कम्युनिटी में, जहाँ इंडिया हमारी कम्युनिटी में आपको पता है आशा वर्कर्स होती है, ऑक्सिलरी नर्सेस होती है और एएनएम्स होती है. They are diploma holders. They are not trained to tackle a situation like HIV. पहले तो हम इंडिविजुअल लेवल पे HIV को टैकल करेंगे. अब हमारे पास एक पूरी कम्युनिटी आएगी HIV के साथ. Community-led services are well intentional, but it can't replace the our professional services. The quality of standards. It will lack professional oversight. And AIDS as a public threat, we need high-level medical experts, not just local community planning. You talked about Rwanda and Eastern African countries. Do you know if they have that best level of community-led services? They totally rely on international aid. ये तो खुद मांग रहे हैं कि हमें दे दो. ये क्या इसमें इन्वेस्ट करेंगे? इनके पास तो खुद पैसे नहीं है. ये खुद से मांग के अपना ये सिस्टम चला रहे हैं. दूसरी बात, जो हमारा NACP phase 5 में है अभी, that is National AIDS Control Program 2021-26. Do you know how much India is investing in these 5 years? 50,471.94 crores. इससे ज़्यादा कितना इन्वेस्ट करेगा इंडिया इस पे? This is too much. Innovation becomes distraction from the sustained care that actually saves lives. For these reasons, we must oppose the motion. Thank you.
As my opponent stated, while these concerns about decentralization and over-reliance on community, they are important. But I would like to emphasize again that transformation focuses on enhancing the medical expertise beyond centralized institutions and not excluding them. Also, the statistics are on our side. We have been able to reduce the AIDS infections by more than 60% in just last 10 years by incorporating these transformative measures in just 45 countries. Moreover, India has been able to reach 50% more people using these specific community services, community-led interaction with the people. So, I firmly believe that transformation is essential so that we can move closer to end AIDS by 2030. And at last, I would like to say कि अगर पुराने तरीकों से ही हमेशा बिना गैस के लीक चलती है, गैस जलाने लगेंगे तो एक बार घर में आग जरूर लग जाएगी.
It's cold today, but our dragons are spewing fire. Let's move on to another segment, doubts related to financing, because other disease conditions remain underfinanced. Political alignments and games may also influence the response towards the disease condition. Let's discuss the political and financial commitment aspect of this disease condition. Let's hear from our participants. First, team proposition will speak in favor of the motion.
Today I stand before you in favor of strong political and financial commitments. Today I do not begin with numbers, I begin with a question. What is the value of a human life when measured against a government budget? In India, more than 2 million people are living with HIV, not as statistics but as parents, school children, co-workers and parents. For them, political and economic commitment is not policy but a survival. Those who argue against investment in HIV or AIDS often say Funds are limited, but history has proven if we invest wisely, we can save both the lives and money. Politically speaking, a government is not only an administrator of funds. It didn't just create policies, it created second chances for millions of lives. For example, India launched the National AIDS Control Organization in 1992. Due to this program, a decline has been shown in approximately 80 to 85% decline in deaths and approximately up to 44% decline in new HIV infections from the last decade. फॉर एग्जाम्पल इन द 1990s ये देखा जाता था अगर कोई एचआईवी पॉजिटिव पेशेंट होता था तो उसको सोशली आइसोलेट पूरा टोटली आइसोलेट किया जाता था और उसको बोला जाता था कि अब इसकी डेथ सर्टेन है बट today because the government made HIV a political priority a daily ART tablet from the government allows a person to live a normal life.
Assalamualaikum everybody. Your point may be logical, but many individuals are diagnosed at advanced stage, reducing treatment effectiveness. Lack of counselors, nurses, and lab technicians affects service quality and follow-ups. Inaccurate reporting and weak follow-up compromises assessment of program success. That's rural and remote areas continue to have limited access to testing and ART centers.
As my worthy opponent said about weak follow-up program success, but as I said, Indian political commitment has reduced new HIV infections up to 45% since the last decade. If the political focus is removed, won't we risk reversing this success? Additionally, HIV government is a guardian of a people's dignity. HIV/AIDS Prevention and Control Act of 2017 legally protects people living with HIV from employment discrimination, health denial, and education exclusion. Example is अगर कोई HIV नर्स हेल्थ केयर फैसिलिटी में काम कर रही है या कोई HIV टीचर स्कूल में काम कर रहा है उनको जॉब से क्विट करना पड़ता था ये नहीं देखा जाता था उनमें कितनी कैपेबिलिटीज है उनमें वो कितने इंटेलेक्चुअल है ये देखा जाता था कि वो HIV पॉजिटिव है तो उनको जॉब से क्विट करना पड़ता था बट ड्यू टू strong political government has given them legal protection and dignity.
Totally fair, but let me correct you. Prevention programs may unintentionally increase stigma or labeling of key population, people living with HIV, and ensures to testing and treatment even for the most vulnerable population. जैसा आप बोल रहे हो कि हाँ ठीक है उनको निकाला जाता है या उनके लिए कुछ और सोर्सेज प्रोवाइड किए जाते हैं लेकिन इमेजिन कोई इंसान है जो एब्सोल्युटली एलिजिबल है विद फुल डिग्रीज उसके पास हर एक डिग्री है वो कंप्लीटली एलिजिबल है कोई जॉब लेने के लिए लेकिन उसको जो कंपनी होती है वो उसको जॉब नहीं देती तो आप जानते हो कि वो एलिजिबल है लोग जानते हैं कि वो एलिजिबल है लेकिन उससे लोग पूछते हैं कि अगर आप एलिजिबल थे तो आपको जॉब क्यों नहीं मिली व्हाट्स द आंसर वो क्या बताएगा उसको बताना ही पड़ेगा कि वो HIV पॉजिटिव पेशेंट है इसीलिए उसको जॉब नहीं मिली What is that? That's a stigma. उस पे वो stigma लग रहा है, वो narrative set हो रहा है कि हाँ ये HIV पेशेंट है.
जैसे मेरी अपोनेंट बोल रही है कि हम इनसे स्टिग्मा इंक्रीज हो रहा है बट गवर्नमेंट सेट राइट टू हेल्थ एंड लाइफ अगर हम वल्नरेबल या मार्जिनलाइज्ड पॉपुलेशन पे ध्यान नहीं देंगे फॉर एग्जांपल सेक्स वर्कर्स है या उनमें आते ड्रग यूजर्स है वो सब उनमें इमेंसली पाया जाता है ये HIV/AIDS अगर हम उन पे ध्यान नहीं देंगे तो ये जनरल पॉपुलेशन में फैल सकता है Plus, India aligned itself with global goals to end AIDS. India committed to 95 target, जिसमें 95% know their HIV status, 95% are on treatment, and 95% are virally suppressed. Also, India's political commitment to AIDS doesn't stop at borders; it saves lives at globally. For example, India supplies over 80% of global ART drugs to developing countries. Example is an HIV patient in Africa survives because Indian government की support की वजह से जो drug का price है वो कम हुआ है.
As you said and as I heard, it saves life worldwide. Huh? It saves life worldwide. Fair enough, but sorry to say, in late 2024, several states like Maharashtra, Delhi reported shortage of HIV drugs due to export of HIV drugs to other countries, making 95 difficult to achieve. So its goals to eradicate HIV by or before 2030.
Statement effectively. Also, financially or economically speaking, HIV/AIDS programs are not a burden. They are a return of investment. Every patient kept healthy through free ART remains productive, independent, and contributive towards the economy. Therefore, overall increasing the economy instead of becoming a long-term burden on the healthcare system. For example, free ART funding. As government is providing free ART funding, this proves government investment directly saves lives, therefore increase economic and productivity. The government of India provides free ART treatment through 700 plus centers. Over 1.6 million people in India are currently receiving free ART treatment. Cost of ART treatment per patient per year is 10,000 to 15,000, which is unaffordable without government funding. फॉर एग्जाम्पल जो इंसान एक दिन में 300 कर सकता है, वो खुद को पालेगा या अपनी फैमिली को पालेगा. सो विदाउट दिस गवर्नमेंट सपोर्ट या फंडिंग ये सब पॉसिबल नहीं है.
ART is free or cheap, but the cost to travel to get medication and the cost related to diagnosis is exponentially higher. Various preventive drugs like lenacapavir are at the center of financial crisis. Pharmaceutical companies have licensed to export these drugs, which has led while being in India at this point.
दैट मीन्स इसमें ये नहीं देखा जाता कि किसके पास कितनी इनकम है, ये गरीब है या अमीर है.
Absolutely, they do stand on the same queue to get a medication, or I can say a basic medication. But when there comes a point to get other medications or other treatments or tests, those are not affordable to all. Hence, they have to part their ways. While not getting that 15% of treatment which ceases the disease symptoms because of unavailability and unaffordability.
My opponent says about affordability, but when the government funds HIV care, it doesn't save one life, it saves generations through prevention of mother to child transmission. India runs free HIV testing and HIV ART medicines for pregnant women. Risk of mother to child transmission has been reduced from 35 to 40% to less than 5%. Thousands of HIV negative babies are born from every year from HIV positive mothers, which means a life has saved before it began.
Yeah, that's true. But prevention programs may face cultural resistance. Like in many Indian states, advertisement related to condoms and other contraceptives is not perceived well culturally, and resistance to sex education in schools.
As my opponent talked about prevention programs, but the market treats HIV as unprofitable, but the government treats it as public responsibility. For example, targeted intervention programs funded by National AIDS Organization reach sex workers, injection drug users, as these groups contribute immensely to new infections if ignored. So government runs awareness campaigns, thereby preventing infections before they spread to the general population. Also, funding AIDS prevent a healthcare bankruptcy tomorrow. That means every rupee spent on HIV healthcare costs is saved. Therefore, increasing economic growth. For example, early ART reduces hospital admissions, opportunistic infections. Therefore, treating AIDS at advanced stages far more costly than treating it at early stages.
That was an intense point. Let's take a deep breath. Awareness also needs oxygen too, right? क्या आपको सच में लगता है कि अगर 100% फंडिंग हो रही है, करप्शन नहीं हो रही? क्या आपको सच में ये लगता है कि अगर 100% हम प्रोवाइड कर रहे हैं, तो 100% बराबर फंडिंग पेशेंट्स तक पहुंच रही है? डू यू रियली थिंक दैट्स ट्रू?
My opponent is saying about corruption. मैं आपको एक बात बता दूं, गवर्नमेंट प्रोवाइड justice. It is economic sense.
At every step of their life. The disease condition itself has trillions of stigmas associated with it. Move on to the another segment and discuss the human rights and discrimination aspect of this disease condition. Let's hear from the team presentation first.
Assalamu alaikum. Thanks for giving me this opportunity to speak. Every person living with HIV deserves equality, dignity, and chance to live a free, a full, and a meaningful life. HIV attacks the body, but stigma attacks the soul. Equality is the care that society must offer. From a human rights perspective, HIV is closely linked to equality, non-discrimination, and dignity. People living with HIV often face inequality not because of the virus, but because of how they are treated in everyday life. They are denied employment, excluded from the education, refused housing, and sometimes receive discriminatory.
These are not social inconveniences. These are clear violations of right. Right to equality, right to live with dignity. When a person is judged, isolated, or excluded because of HIV status, non-discrimination fails.
Today, nearly 39 million people worldwide are living with this HIV disease condition. Many of whom can live a happy, many of whom can live a healthy and a protected lives. But this is only possible when the society removes the stigma and upholds equality. HIV is a medical condition, not a social issue.
Statements. All I'm getting is you are fighting a social war from 1990s while we are fighting a biological crisis in 2025. You cannot legislate a virus out of existence and dig argument is inequality kills, but the data shows, the data proves the logistics actually kill. According to UNAIDS 2023 data, 9.2 million people living with HIV are not on antiretroviral therapy ART, and this is not a joke. These people are not dying because they were offended or excluded or they were denied basic human rights. These people are dying because of supply chain failures. जैसे कि मदिया ने बोला corruption हो रहा है, supply chain failure कहीं ना कहीं पे है, and funding gaps are also there. We also claimed that we need to fight for equality and non-discrimination. But for your information and for the information of everybody present out here, I want to clear that HIV and AIDS prevention
2017 already exists and it legally criminalizes discrimination in employment, discrimination in education, and discrimination in healthcare. We do not need more awareness. What we need is the proper and strict enforcement. When a patient is turned away, it is not always because of the social malice. It is because of lack of PPE kits and surgical safety protocols. While you focus on the feelings, the virus is focusing on the mutation. The WHO reports rising drug resistance in several countries, like the drug resistance in the drugs like neurotropin has already existed 10%, and this is also not a joke. You can give patient all the dignity and housing in the world, but if the virus mutates and registers the drugs, the patient will still die. Social acceptance does not stop viral replication, but what stops it is the updated pharmacology and implementation of the rules and regulations. Regarding this denied employment, I want to clear your misunderstanding or misinformation, whatever it is. under HIV and AIDS Prevention and Control Act 2017, discrimination in employment solely based on HIV status is strictly prohibited. A right reinforced by the constitutional guarantees of equality, non-discrimination in public employment, and right to life and dignity under Article 14, 16, and 21 respectively, denying jobs solely based on HIV status is a criminal activity and illegal. However, in high-risk occupations, I will mention this and I need to mention this. However, in high-risk occupations such as organ transplantation units, emergency trauma care, military combat roles, medical fitness standards exist for everyone and not only based on the disease condition. अब सबको पता होगा कि वहाँ हाइट का भी फैक्टर रहता है. हाइट वालों को तो HIV नहीं होता है ना, मतलब कि ये स्पेसिफिक कम्युनिटी को टारगेट नहीं कर रहे हैं. She spoke beautifully about the right to live with dignity, and you spoke it very beautifully. But what I am speaking about is the right to life itself. जब इंसान जिंदा ही नहीं होगा, dignity हम देंगे किसको? Equality. The harsh reality is you cannot exercise human rights from a graveyard. कब्र से तो किसको हम human rights देंगे? Until we fix the supply chain, crash viral load, and solve drug resistance, we must stop romanticizing the disease as a civil rights struggle and start treating it as a medical emergency. My opponent wants a world where HIV status is a private secret, protected by the shield of dignity. And I want a world where HIV is a public health reality, shielded by the safeguard of safety. And we cannot legislate the virus away with kindness, and we cannot stop transmission with inclusivity. Public human rights must coexist with the public safety and public health. We can only stop it with rigorous testing, honest disclosure to the relevant authorities only, and evidence-based restrictions. If prioritizing the lives of many means restricting the liberties of the few, then that's a price ethical governance must be willing to pay for it.
With due respect, I would like to address these points. The previous speaker calls this a social war of 1990s, but discrimination in the hospitals, jobs and communities is not a history. It's happening now. This makes the 2025 human right crisis not nostalgia. It suggested that dignity does not rise. CD4 counts, that's correct. Medicine does, but the medicine don't walk into the patient walk into the hospitals. The argument claims inequality does not kill. The logistics too. With due respect for this, I would like to respond. चाहे दवाइयाँ कितनी भी अच्छी से दी जाए, वो लोग नजरअंदाज किए जाते हैं, वो बच नहीं सकते, किसी भी तरह बच नहीं सकते. तो ये कहना सही रहेगा कि नजरअंदाजी से लोग मर जाते हैं. And the human rights are the bridge between the logistics and survival. And UNAIDS data is cited to show millions are off act due to supply failures, but the fear of stigma and denial keeps the patients from registering in the first place. तो ये कहना किसी भी तरह से गलत नहीं होगा कि सप्लाई से पहले ही निजाम नाकाम हो रहा है. The argument claims equality is already solved on the paper. You said about Article 14, Article 16, and Article 22, but the laws exist, but reality disagrees. A right unenforced is right denied, and a law just on the paper is not. A law just on the paper does not protect a patient in the reality. And my worthy opponent also mentioned that he said that human rights cannot help human rights won't help in the graveyard. That's why we must enforce them before graveyards come into the question. और ये भी कहा जा रहा है कि one medical fitness standard is applied equally to everyone. तो बाकी और इतनी सारी बीमारियों को consider किया जाता है इसमें. That means if someone doesn't mean it, it cannot be accommodated. But I would like to mention equality does not mean the identical treatment, but it means the fair treatment.
It has also been argued that restricting the rights of the few is acceptable if
I respond.
rights cannot be sacrificed for convenience. Every patient denied care
His life lost unnecessarily, and we should be aware about the fact ignoring the rights of few means we fail everyone.
ठीक है, हम एक काम करते हैं, गोल्डन ब्रिज बनाते हैं, फिर जब उसके आगे हॉस्पिटल होगा ना, उसमें एम्प्टी शेल्व्स रखेंगे, ART की मेडिकेशंस नहीं रखेंगे. फिर गोल्डन ब्रिज बनाने का फायदा क्या है जब ऊपर से वहां से मेडिकेशंस नहीं मिल रही है. So let me start now. Okay, you admitted that laws already exist on paper. You admitted that medicine is what rises the CD4 count. Basically, you are agreeing with it, but You are not realizing it. You talk about fear keeps patients away. Let me give you a real example. In 2022, HIV patients protested outside NSO office in Delhi for over 40 days. Why? Not because they were denied human rights, not because they were treated unequally, but because medicines like dolutegravir, antiretroviral therapy medicines were out of stock for many months. That is why, without caring for their dignity, they came on the streets, protested against the unavailability of the medicines. That means people not only require dignity, not only require human rights, but they require primarily is the medications first. जब उनको फिर हम ट्रीट करेंगे मेडिकेशंस पे होंगे उसके बाद we can give them human rights and whatever they deserve. और रही बात you argue that laws exist on paper. Yes, that's true. And laws don't stop discrimination, but that's not the problem. We don't need more awareness campaigns or emotional human rights talks. What we need is the strict enforcement. अगर आप में से कोई जियोपॉलिटिक्स या करंट अफेयर्स फॉलो कर रहा होगा तो आपने ट्रम्प का एक स्टेटमेंट बहुत बारी सुना होगा कि दो आई डोंट एडमायर हिम बट आपने उसका एक स्टेटमेंट सुना होगा कि आई बिलीव इन पीस थ्रू स्ट्रेंथ सुना होगा आपने और उसने वो अचीव भी किया ही इज अचीविंग पीस थ्रू स्ट्रेंथ वी कांट डिनाई दैट थिंग so in the similar way government has the strength government has funding government has resources and government has rules what we are lacking is the lack of implementation. That means it is not the matter of human rights only, but the where the failure is, it is at the administration level. She said you can't save many if you abandon the few. If the few refuse mandatory testing because of privacy and they spread drug-resistant virus to the many, then the community suffers. The speaker on the proposition side thinks protecting a secret is more important than preventing an epidemic. Can you believe this? I strongly disagree with this. A hidden virus is a biological weapon and public safety is the ultimate human right. In conclusion, she wants to fight the virus with feelings and I want it to fight with the proper precautions, implementation and execution of laws and proper supply chain management. She worries about how the patient feels and what I care about is how the patient lives.
The other side highlights personal privacy as a reason to avoid testing. But I would like to point out it's not the privacy that endangers lives, it's fear. Remove fear, build awareness, and people will step forward without risking the community. तो privacy नहीं, खौफ से लोगों की जानें खतरे में जा रही है. And it's thought that rules and the precautions alone can stop HIV, but precautions alone don't stop HIV. People hide, fear spreads, and virus wins. I fight it by combining awareness and the care. Action and the trust. And trust isn't emotion here. I would trust isn't emotion here. It's what keeps people on the treatment. And that's how lives are actually saved. Thank you.
Both sides have put forward quite strong points that in HIV would take twice before attacking awareness. Let's wrap up this session. We have accepted that it's medical science that needs improvement. It's the social aspect that needs improvement. It's the government policies and the rights that needs improvement. It's not only the aspects of the science or the science or the puzzle of the science that we need to solve. Until we address the disruptions, the funding issues, and the human rights of every individual, our response will remain incomplete. Thank you, everyone. Thank you, all the faculty members and the students, and especially the participants. And thank you to our organizers who have made this event possible, Ms. Unakaman and Ms. Nazman.
वो इनमें जीत मैं मुझे नहीं हो गया अच्छा क्योंकि नर्वस